Evening, all. Let us talk one more topic on biochemistry, that is thyroid profile. So, the objectives of the presentation. So, we need to discuss regarding anatomy of the thyroid gland, its functions, hormone production, regulation, then some of the disorders, which includes autoimmune conditions. Then the main concept, the thyroid gland hormones, that is thyroxine T4, triiodothyronine T3, and calcitonin. Then in detail, we have to discuss regarding thyroid profile. So thyroid gland, you can see the anatomy. The thyroid gland consists of two lobules. So here we can see the picture. This is one lobule and this is another one. Connected by a thin strip of tissue. This is known as isthmus. The middle part is which is connecting right side and left side lobe togetherly by the connector, that is known as isthmus. It is situated in front of the trachea. Now in the picture we can see the thyroid gland is situated in front of the trachea and below the larynx. Then coming to the function. So what is the main function of the thyroid gland? Production of hormones that regulates metabolism, growth and development throughout the, and these hormones are thyroxine, that is known as T4, and triiodothyronine, that is T3, which influence nearly every cell in the body and are essential for maintaining normal physiological process. These two hormones are very essential for maintenance of the normal physiological process. Then coming to the hormone production, the thyroid gland synthesizes T3 and T4 using iodine and an essential mineral obtained from the diet. This iodine we are receiving from the diet. So T4 is a predominant hormone produced by thyroid gland. It is converted into more biologically active T3 in various tissues throughout the. So here we can see here T4 is a predominant hormone. This is the main hormone which is produced by the thyroid gland. But what is happening? It is converted into more biologically active form of T3 in various tissues. Then coming to regulation, the secretion of thyroid hormones is regulated by feedback mechanism. So what is this feedback mechanism? Involving the hypothalamus, pituitary gland and thyroid gland. And here the hypothalamus is producing, what is this? TRH. So what do you mean by TRH? Thyrotroponin releasing hormone, and which stimulates the pituitary gland. So this TRH is going to stimulating the pituitary gland for releasing of thyroid stimulating hormone, that is known as TSH. And this TSH in turn stimulate the thyroid gland. So this TSH, what it is doing? It is going to stimulating the thyroid gland to produce and release T4 and T3. And when blood levels of T4 and T3 are sufficient, they inhibit the release of TRH and TSH, thus maintaining a normal or hormonal balance. So what is happening here? When our body there is sufficient amount of this T4 and T3 is available, automatically there is a stoppage of production of this TRH and TSH. Then it will be helpful for the maintenance of the normal hormonal balance. Then if the thyroid function getting any abnormalities, what kind of disorders can we identify? So dysfunctioning of the thyroid gland can lead to some conditions like hypothyroidism, that is also known as underactive thyroid, and hyperthyroidism, that is overactive thyroid gland. Then hypothyroidism is often characterized by fatigue, weight gain and cold intolerance. So whenever the patient is suffering with hypothyroidism, the most symptoms are fatigue, weight gain and cold tolerance. Whereas hyperthyroidism are manifested by the weight loss, rapid heart rate, heat intolerance. So some of the autoimmune conditions are going to occur. These are Hashimoto's, thyroiditis, and Graves' disease. Now we can see this is a normal thyroid gland. If the patient is having any Hashimoto's disease, there is an enlarged and inflamed interactive thyroid gland. That's also known as goiter. And here we can see sometimes symptoms of hashimotoxicosis. What do you mean by toxicosis? This toxins level or the hormonal level will be increasing in the blood. So in that condition, some kind of changes we can see because of the autoimmune disease condition. The patient may be suffering with the or identifying looking as a fatigue, continuous sweating, goiter. Enlargement of the thyroid gland will be located or identified, and tremors in hands. Hands can will be getting the tremors and intolerance to heat. So they can't able to tolerate the heat, and changes in the mood. Mood will be changes and changes in the bowel movements. Then another condition because of the autoimmune condition, that is Graves' disease. So what kind of symptoms we can see? Sweating we can notify. Patient is having tremors, ectophthalmos. So what do you mean with this condition? Exo means outside. So the eyeball may be looking towards the externally. That is ectophthalmos. Then goiter. So goiter, enlargement of the thyroid gland will be located, and person may be having arrhythmia and tachycardia. So increasing of the heart rate can be notifying here. And also coming to the GI system, patient may be having this nausea and diarrhea. Then coming to the reproductive system, he may be identifying, sorry, she may be identifying with the oligomenorrhea, and that is in the female. And then here also we can see this musculoskeletal system. So person may be suffering with the muscle weakness. And thyroid function can be assessed through blood tests that measures levels of TSH, T4, T3, and some of the thyroid antibodies. So some, and also we can send the patient for the ultrasonography and thyroid scans. May also be used to evaluate the structure and functioning of the thyroid gland. The overall, the thyroid gland plays a vital role in, so what how it the main importance of the thyroid gland is maintaining metabolic homeostasis and overall health. And what are the thyroid hormones? The thyroid gland primarily secretes two hormones. What is the major two hormone? Thyroxine, that is also known as T4. So thyroxine is the main hormone produced by the thyroid gland, and it contains four iodine atoms. That's why we are considering as it is a T4 thyroxine. So four, which consists of the four iodine atoms, and is relatively inactive compared to the triiodothyronine. So here T3, this T4 serves as a precursor to the T3. So this T4 will be helpful for the T3, and it is converted into T3 in various tissues throughout the body. Usually this T4 will be inactive in the body, and which helps to T3, and it is acting as a precursor. Then triiodothyronine, that is also known as T3. So triiodothyronine is the active form of thyroid hormone. It is very active form of thyroid hormone, which contains three iodine atoms. How many? Three. Three iodine atoms, and it is more potent than T4. T3 regulates metabolism. This T3 hormone will be regulating the metabolism, growth and development, and it has more direct effect on target tissue when compared to T4. When compared to T4, T3 is the mostly form of actively present in the tissues. Then another hormone is calcitonin. So additionally, the thyroid gland also secretes small amount of other substance that is also known as calcitonin. Calcitonin helps to regulate. How it is helpful? It regulates calcium and phosphate level in the blood, and it is involved in bone metabolism. So this calcitonin will be helpful for the bone metabolism. However, calcitonin is not considered a primary thyroid hormone like T3 and T4. When we talk about thyroid hormones, mostly we give importance to the T3 and T4. Then comes when it comes to thyroid profile, a thyroid function test is a blood test used to evaluate how well the thyroid gland is working. So in this thyroid profile, we need to send some of the investigations to notify how well the thyroid gland is functioning. The thyroid gland produce hormones that regulate body metabolism, growth, and energy levels. And the test measures levels of uh, triiodo thyroid stimulating hormone, that is TSH, thyroxine T4, and sometimes triiodothyronine, that is T3. So abnormal levels of these hormones can indicate various thyroid disorders as hypothyroidism. Another one is hyperthyroidism. And thyroid function tests are commonly ordered if a physician suspect thyroid dysfunction. If the physician suspect the patient is suffering with any abnormalities relevant to thyroid, like symptoms like fatigue, weight changes, or changes in the heart rate. The first one is thyroid stimulating hormone. That's the short form we can notifying as a TSH. So the normal range is 0.4 to 4.0 milli international units per liter. So this TSH is produced by the pituitary gland. Pituitary gland is also known as master gland, and which stimulate the thyroid gland to produce T4 and T3. High levels of TSH indicating hypothyroidism. So when we are checking the patient hormone level of this TSH will be notifying higher, which is denoting as a hypothyroidism. And while low levels will be suggesting for the hyperthyroidism. Then coming to total thyroxine, that is also known as T4. So the normal range is 4.5 to 12.0 micrograms per deciliter. And the T4 is the main hormone produced by the thyroid gland, and it plays a crucial role in regulating metabolism. So abnormal levels of T4 can indicate thyroid dysfunction. When we notifying this abnormal level of T4, which is indicating thyroid dysfunction. Then coming to free thyroxine. So what do you mean with this free? Let us see. So the normal range is 0.8 to 1.8 nanograms per deciliter. So here free T4 measures the amount of T4 that does not bound to proteins. So whenever we see the meaning of this free, which meaning is which measures it measures the amount of T4. So whatever amount of the T4 will be there, that is not going to bound to the blood, that is not going to bound to the protein in the blood. So bonding means attachment. So the level or the hormone level which is not bounding, the amount of the this T4 which is not bounding to the protein, that is known as free thyroxine. This test can provide a more accurate assessment of thyroid function compared to total T4. So when we see this test can provide a more accurate assessment of thyroid function when compared to total T4. This free thyroxine T4 will give more accurate result rather than the total T4. Then total triiodothyronine, that is T3. So the normal ranges are 80 to 200 nanograms per deciliter. So T3 is another thyroid hormone that plays a role in the regulating metabolism. So most of T3 in the blood is produced by the conversion of T4 to the T3 in a various tissue. How the T3 will be notifying? So this T4 will be converting towards the T3. So let us talk about regarding this free triiodothyronine. Normal ranges 2.0 to 4.4 picograms per milliliter. So free T3 measures the amount of T3 that is not bound to protein in the blood. So here whenever we need to remember what do you mean by this free triiodothyronine, which meaning is the amount of T3 that does not bound to protein. So what are the amount of T3 is there that is not going to bound to the protein in the blood. That is considered as a free. So like free T4, this test provides a more accurate assessment of thyroid function compared to total T3. So this investigation also will give more accurate assessment of thyroid function when comparing to total T3. Then coming to antibodies investigations, the first one is thyroid peroxidase antibodies. So what is the meaning of this? Thyroid peroxidase antibodies. So the normal ranges, it should be less than 9 international units per milliliter. So this antibody is an antibody that can attack the, so what is the antibody name? Thyroid peroxidase antibody. So this is an antibody that can attack the thyroid gland, leading to autoimmune thyroid diseases as like Hashimoto's thyroiditis. Then another antibody investigation is thyroglobulin antibodies. So the normal ranges, it should be less than 4 international units per milliliter. So this TgAb meaning is thyroglobulin antibodies is another antibody that can attack the thyroid gland, indicating autoimmune thyroid disease like Graves' disease. And these ranges may be vary slightly depending on the laboratory and the specific assay used for testing. It's important to interpret the result in a consultation with a healthcare provider, as they can provide context based on individual health factor and symptoms. And let us summarize our topic. So we have discussed regarding thyroid gland, its functioning and the hormones and the major disorders and then autoimmune conditions. So the thyroid hormones are mainly thyroxine, that is known as T4, triiodothyronine, that is T3, then another one is calcitonin. And the thyroid profile, under thyroid profile, we have discussed regarding TSH, T4, T3, then free triiodothyronine, and some of the antibodies, that is like thyroid peroxidase antibodies and thyroglobulin antibodies. I hope, my dear students, you understood the topic of thyroid profile. Once again, we'll meet. Have a nice day.